So when we're getting into hepatic encephalopathy, liver doesn't work well, and the toxins are building up. Ammonia getting more and more abundant in the blood, and it's getting into the brain, and also neurotoxins resulting from hepatic failure. Ammonia is not recycled, and it's not taken out, and it will affect the brain function, and a patient will start having personality changes, confusion, memory loss, unusual behaviors, and patient may become comatose and die because of that. Ammonia levels need to be reduced, and the most common treatment nowadays is still lactulose, although there are other treatments which by antibiotics which may cause the decrease of ammonia. But lactulose is very unpleasant treatment. Patient will have diarrhea, and non-compliance is quite common, and when patient starts being non-compliant, they will eventually slip into personality changes and confusions and even end up in the hospital. So at that time, again, the lactulose or other treatments may be reintroduced. But there are more and more antibiotic oral treatments that may help with this versus lactulose. So let's talk about viral hepatitis here. Hepatitis A and B and C. And I would like to talk today only about A and B, and E and G, like you see here, very uncommon in US. D is requiring presence of the B for activation. So A, B, and C are the most common types, and those are viral diseases that will affect the liver. Hepatitis A, fecal oral transmission, and it can be excreted in feces, bile, and serum of the patient. And fecal oral route is most common, and again, it can be from crowded unsanitary conditions, also food and water contamination. Water contamination, sometimes having shellfish and shrimp or oysters from that lived in contaminated water, especially oysters, which may be consumed raw, and food usually. Unfortunately, it's a restaurant outbreak. There are studies done that the chances of completely recovering for a restaurant after hepatitis A outbreak, 3 to 5 years. So that much like financial and reputation damage done. But for the patient, is the good news. It's usually most of the patients will combat this by themselves on having palliative care, really, and do not require medication and hospitalization. But it's definitely high morbidity disease, low mortality, high morbidity, and patients will be affected by this. They should be on somewhat isolation, like contact isolation at least, and their feces have to be isolated and decontaminated sometimes. So it brings lots of infectious control issues. Also, it brings also food service issues. This usually shouldn't happen, but it does, and it's usually come from one person who didn't wash hands after going to bathroom and serving food. So bottom line is, don't eat out as much as you like eating out. You are not the one who cooks that food, and there is no guarantee that you won't have hepatitis A, although it's understandable that every facility, every restaurant makes every effort to not introduce foodborne disease, but chances of getting hepatitis A are higher if you eat outside versus you cook your own food. Besides, you will save lots of money on that too. So the bottom line is, this is disease with high morbidity, very low mortality. It's debilitating, and it will take lots of long time for patient to get back to normal, but usually patient will recover themselves. Approximately 10% people or so may have bad liver failure and may need further interventions from hepatitis A, but usually those people who have already some type of liver condition and hepatitis C or cirrhosis. That's why it's important, if you have a patient with hepatitis C or B, to immunize them for hepatitis A, because that will prevent development of hepatitis A on the top of hepatitis B or C. Hepatitis B is transmitted through contact with blood and body fluid. So it's not fecal oral route anymore, it's a body fluid transmission. Maternal transmission can happen, and vaccine is available, and if you work in healthcare, it's certainly a good idea to have vaccination. Treatment is also available for antiviral treatment for hepatitis B. However, again, the treatment process is very lengthy, and the results may not be, there is no 100% cure or 100% effective treatment for hepatitis B. The contamination or transmission occurs again through blood, body fluid, sexual contact, and contaminated needles. However, the rates of hepatitis B nationwide are much lower versus rates of hepatitis C. So hepatitis C is another blood-borne disease. There are many sources speculated about hepatitis C transmission. Sexual contact is blame, also like body fluids, but there is more and more evidence that hep C is truly blood-borne disease. It's not going through body fluids much. And IV drug use is certainly implicated, and transfusion, blood transfusion, used to be one of the causes of hepatitis C transmission, but nowadays we screen blood very thoroughly, and this is virtually impossible to get hepatitis C or HIV from blood transfusion nowadays. But approximately 50 to 80% of hepatitis C will result in chronic hepatitis, and it all depends. 50 to 80% depends on genotype. So this is, but small percentage, approximately 20% on average, or less even, may develop immunity to hepatitis C and cure hepatitis C by themselves, patients. But they will be certainly, what I'm trying to say, people who develop immunity by themselves to hepatitis C are a focus of some studies trying to find vaccine for C, which is not available, or further learn more about hepatitis C and try to find more efficient medication. There are antiviral preparations for hepatitis C available, and the treatment is available, and there is a approximately, depending on the type of genotype of C, cure rate can go up to 80% and like 50 to 80%. Again, I will not be asking you on exam or elsewhere that percentages of cure rates or the epidemiology and statistics, so this is just FYI information. But treatment is available, and hepatitis C stays long very dormant, and nowadays usually it's accidental discovery on routine blood test when patient present with elevated liver enzymes. Further workup will show that patient has hepatitis C, and sometimes the source of the disease is absolutely unknown, or we don't know where patient received it, but they may have contamination with needle 20 years ago, or they did some drug 30 years ago, they don't remember, but sometimes patients just have no clue where this appeared. And again, treatment is available, so every time you see your patient has hepatitis C, you may elect, you need to refer them for hepatology clinic or gastroenterology clinic for further evaluation and treatment.